My dear students, in our series on tips, techniques in pathology for students, I am concentrating on the clear, correct and concise, the 3 C's for each of the techniques. This happens to be extremely important because a sizable amount of our theory questions are based on techniques which shall be quite difficult to answer unless we rehearse, repeat and revise. The topic for the day shall be liquid-based cytology. I hope your people are able to identify the two pictures. One is the broom and another is a brush. It mimics the tail of a squirrel. Both of these have got some kind of a meaning in their function. That means all the bristles work in unison. This is called a synchronous rhythm, in the same direction, in the same speed. This also in the same direction and in the same circle. Whereas if they work in different directions, it is called metachronous. So let us have this in mind. I'll go to the pictures first. So this is the cervicovaginal junction. In fact, it will be better if I call it the squamocolumnar junction. And for obtaining the cytological sample, a brush can be used, which is called the cervical brush. And look at this one. There is a single deliberate movement in which the brush is moved so that you find samples from all the walls and there is no overlapping or losing the sample that we have already got. So this is the endocervical canal and this is the vagina over here and this is the ectocervix and this is the junction where we will be having the columnar cells and the squamous cells. Extremely important. The brush has been designed in such a way that it will be fetching greater amount of cells. Coming back to our definition, liquid-based cytology is a thin layer or a monolayer of a smear preparation. The objectives are to overcome the shortcomings of a pap smear, and it was initially used for cervical cancer screening, but nowadays, as we shall see towards the end, there are other uses also. The steps include collection, fixation, homogenization and rinsing. This is a brush with a similar purpose. Here again I am seeing an arrow, which means in one deliberate spinning motion the samples are obtained from all the walls, and this is supposed to be more representative than the pap smear as such. The introduction continued. The aim is to improve the transfer of cells from the collection device to the microscopic slide. This is very important because usually a lot of cells appear to be lost when a conventional IR spatula is being used, and it is to provide a uniform cell population in each slide. In a pap smear, there is a good ability for screening the cervical cancer. However, it is less sensitive and there can be false negatives. We have been negative in a pap smear, but the patient turns out to be an ascus or a low squamous cell carcinoma. Look at this. The cervical brush we had seen earlier, and it is introduced into the medium. There is again a spinning motion which helps in the distortion of the cells, and they all get suspended or dispersed. And again there is a filter that is being applied onto it. This has got a suction force by which all the cells which are suspended over here go into the container. There is a filter, and to this the cells get adhered. And finally, from the filter as such, it is being mounted onto the slide or transferred to the slide. That is how you get a circular or an ovoid shape. You people should have this very clear. Whereas in a pap smear, it is a smear as such. What are the common troubleshootings? One, it will be using an incorrect sampler or a tool. You will have to choose the correct tool. Second one is not using the tool or the method properly. Third one, air drying, which will lead to artifacts. Sometimes the smear can be having too much of mucus, or there can be a poor fixation, which will lead to artifacts. Sampling error is obvious. We always get the pap smears without the columnar epithelium. And there can be inflammation and hemorrhage, which can obscure the screening. Finally, interpretation is also difficult and it is laborious. So this is the conventional one. You are able to see the various organs. I will not go into the detail. The uterus, the vagina, and then there is a speculum that is over here and the brush. And this is the bladder in front and the rectum anal canal posteriorly. A sampling is obtained and then we find that. What are the reasons for an unsatisfactory smear? One, the squamous component is too much and there can be scanty or absent columnar component. As I mentioned earlier, obscured by blood or inflammation, thick areas, mucus, poor fixation, air drying artifacts, and contamination. These are all the reasons for a poor smear. And look at the way it is being preserved, and it has to be used separately and discarded in the manner as I am going to show you. 75% of the smears will be having these elements. Therefore, you can imagine how much of precious material is being lost. This is a summary which you people shall by heart. There is no other go. I put up the table for the pap smears and the liquid-based cytology. What are all the advantages on one side and the disadvantages on the other side? Pap smear, it is a gold standard. We cannot say that it is useless. It has made us diagnose cancer. There is a comfort and it is ready for staining when it arrives in the laboratory. The disadvantages, however, are a lot of material is being lost and a lot of cells will have to be screened. In fact, we may be missing. It is actually looking for a needle in a haystack. Uneven distribution of the cells and artifacts. Coming to liquid-based cytology, virtually all the cellular material is being collected. There is a ease of preparation and nothing to obscure, even distribution, well preserved, decreased screening time, and microorganisms are also preserved. Extra slides can be made from the material that is available. Also, you find molecular studies can be done with the additional material. The disadvantage, however, is it is a new technology. Even senior people are not familiar with it. So, there is an element of insecurity. There has to be a training of the cytotechnician and even the cytopathologist. Increased workload, there is a monotony in the work. Fixatives, they have to be important and they have to be disposed also. There is an increased cost and vigilance is required. So these are the various materials that are being used. This is a classical R.A.T.S spatula. You find it has got this kind of a shape so that the ectocervix and the endocervix are both being sampled. Again an R.A.T.S spatula which is wooden. In this case it is more porous and hence there will be a greater absorption. Whereas in this one the material can be transferred easily to the slides. This is the broom that we have been talking about. You find that these are the bristles of the broom and in one rotating movement you will be able to get the samples. Sometimes, however, the brush over here, the brush and the broom are used in combination for a better advantage. So these elements I hope you people will be able to identify. The names are given over here, please memorize. This is a table of the collecting devices, the methods and the observation or comments. Higher spatula wooden, it is porous, there is loss of cells. Plastic, there is a better transfer rate of cells. Cotton tips moistened with saline can be used, there is a moderate success. And in endocervical and brush and broom, you find that there is an improvement. However, it is inadequate when used alone, and therefore the recent combination of a broom and a brush are most effective and the cell yield is high. The techniques for liquid-based cytology. It can be collected by means of a broom, brush or spatula. I have highlighted the keywords. The cells are suspended into a methanol-based fixative solution. Usually the company provides one which they will not divulge. There are two, the ThinPrep processes which disperses the sample. Mucus and the other debris are removed and the cells are collected onto a vacuum filter. This is followed by staining and interpretation. See the classical difference between the conventional pap smear and this. Incidentally, these are the fixatives. Ethanol, methanol, sometimes formaldehyde is used. And the stains are either the pap stain, Romanowski stains, such as the MGG or the GMSA itself. There are two procedures in this which I would like you people to kindly follow. In one, there is a spinning motion by which there is a dispersion of the cells, and then all the dispersed cells, they get collected onto a filter, and when they are adherent to the filter, it is touched on to a circle within the slide where they are transferred to. This is followed by fixing and staining. The next one is a little more complex or seemingly so, but not difficult. Just follow what I am saying. The first step is vortexing, second one is disaggregation, third one is transfer to a sedimentation tube, and you find that there is a sedimentation, dilution that is happening, and finally the collected cells are being disposed onto the slide from the filter. Vortexing, incidentally, it means a whirlpool. A vortex means a whirlpool. That is the physics of the spinning motion. By means of a spinning motion, I find that there is a negative pressure that is being created where all the cells are being pulled into. Therefore, not much cells are being left in the bristle or the brush. There is no loss of material. There are two classical methods which have been established, the ThinPrep and the SurePath. These are all the proper names used by the companies. There are others also such as the cytoscreen, Turbitech, cell slide and pap spin. Maybe a few also have come into force now. I would like you people to kindly know these so that you mention it in your examination. And this is a remark. After the purpose is over, you find that be it the spatula or the brush, the tip is broken so that it is not used, there is no contamination again. And look at the smear over here, it is quite thin, there is a uniform distribution of the cells, not much empty space is seen, there is no mucus or hemorrhage. In fact, not much mucus or hemorrhage. This is one of the advantages of this method of preparation. What are all the advantages? You find that there can be representative cervical sampling. These are all the endocervical cells with a little bit of dysplasia, and these are the ectocervical or the vaginal cells which can be seen. And the cytosamples are fixed immediately. Lesser amount of artifacts. No inflammation, mucus or debris. Cells are in a monolayer as we had seen in the last slide, and better results when compared with the PAP. very easily prepared so that you people can memorize and write in your examination. The advantages continued is you find that there can be residual material which can be used for HPV. The mechanical distortion is minimal. Histochemical analysis can be used from a cytospin, and also you find that there can be a screening test done for human papilloma virus. So this picture again shows the same thing. I would like you people to kindly read the text and then write it in the examination. There are some disadvantages, however. One, the nuclei are vesicular and delicate. Here, they are not very strong as they appear in the conventional pap smears. Maybe the fixation is a little delicate over here. And then there are fewer landmarks for human observation. Whenever we do see a pap smear, there will be things that we will be noticing which are missed in this. It is challenging, it is time consuming. There can be rounding up of the epithelial cells so that they can be mistaken for the smaller intermediate cells or sometimes even the parabasal cells. The morphology is a little different and we will have to get tuned to it, and it requires experience for familiarity. So these are some of the disadvantages. Definitely I am sure you people will be able to write this. And look at the features over here. This is the liquid based preparation and this is the conventional preparation. So the cell cytology is well maintained, the superficial cell and the intermediate cell, and there is hardly any background material. Whereas here there is a lot of overlap, mucoid debris is there, and sometimes there is a breakup of the cells. So the debris in the background you people are supposed to make out, which is hardly seen in this. There is also something called as automation in this. After the collection of the cervical sample, the tip is placed in an ethanol based preservative, and there is a mode called the auto site preparation. As I told you earlier, don't get perplexed when you see these words. These are all terms created by a company, and within that there will be some details which they will not be divulging with. So they are all supposed to be their properties. And you find that a lot of this mucus and blood is removed and then it can be transferred onto a cytospin. Slides can be made and stained. There are also non-gynecological uses. In fact, what are the uses? They can say that thyroid also. That we shall see at a later date if time permits. But please do remember, it can be used for a thyroid cyst, in oral pathology, any of the body fluids, peritoneal fluid, urine, pleural fluid, etc. Brush samples from the GAT or the lung. Aspirates, particularly from cystic diseases of the breast. Metastatic tumors of unknown origin. Metastatic tumors in the CSF. These are all some of the non-gynecological uses of the LBC or the liquid based cytology of ThinPrep. SurePath is another company that prepares a similar mode. So this is again a repetition. You find that SurePath is here, and what is the amount that is required, what is being transferred, it is being centrifuged and it is being resuspended. Resuspended means so that we wash off all the unnecessary material and ultimately you get only the cellular material. The unwanted material is being decanted or removed. Rarely you find that cell blocks also can be prepared. Cell blocks means after spinning you get a concentration of the cells. The advantage of this is when there is a sparsity of cells in the smears, the cell block gives you abundant cellular material. To some extent the architecture or a pattern can be deciphered or understood. Morphology is fairly well preserved. I can even see a mitotic figure in this. It can be used for immunohistochemistry. If it is going to be used for electron microscopy, glutaraldehyd should be the fixative. Multiple slides can be made. This is one of the trump card of the cell block. The disadvantages, obviously, there will be a delay. Cytology is supposed to be for a rapid diagnosis, whereas there is a routine processing, there will be a delay. and substances such as methanol can interfere with immunohistochemistry. This shows a series of pictures made by the conventional method as well as by a company providing the easy prep reagents. Here there is overlapping etc. and the cellular details are not that clear, whereas the dysplastic cells are better brought out by this method in easy prep. Also the cytological details are better brought out. So when it comes to the question of counting the cells or analyzing it, this is the method to be followed. It is from the Mayo Clinic. A circular field has been prepared and the entire length and breadth of it should be covered, including empty spaces which may be present, called as holes. And in this, we will be able to see increased amount of cellularity, and also the sparsely cellular areas are taken into account. So this is the magnification in which this is the method of counting. This diagram also you people can draw. So anything can be automated. So I would like you people to sequentially follow this picture. Thin preparation screening systems are there, and there is an image station. So obviously an image has been produced out of it, and there is a review scope in which it is mounted and then it is being studied. Also there is a navigator pod. Navigator pod is this one which is able to help us move it around, maybe a mouse. And there is a slide profiler. Slide profiler is one that shows extensive fields of it so that the correct one can be chosen for the picture. There is a slide processor also in this. Finally, there is a screening review station which can be linked to the barcode. Finally, the pictures are being created, they are being given a specific label and mounted as such. Later on, they can be reviewed. The major advantage of this is you find just like different pathologists can see different slides, here multiple people can see multiple fields of it. Also, there can be a group discussion following which there can be a consensus arrived at. What are all the future advances in this? One is HPV testing, we had mentioned. Automation, which we had mentioned in the previous slide. So the subjective nature is done away with and it is being done by the machine. Computer assisted pap test, screening every unit space. This is what we had seen in the Mayo slide also. And these are certain specific names or proper names given: focal point device or ThinPrep imaging systems. They can be used for the computation, and much more are there. Look at this one, R.A.T.S scans, cytology. So these are the pictures that are seen. Obviously, this cytologist is not going to see each and every one, but they are going to be captured and they will be fed onto it. They may be magnified, they can be studied by different people, maybe in different parts of the world also. And this is definitely a boon which has to be borne in mind. Thank you for watching.